Good afternoon, dear colleagues. It's really a great honor and a great pleasure to join you today. And thank you for the opportunity to present this work. So this is indeed the All-Can International Action Guide for Efficient Cancer Care. I'd like to stress that this was a co-development process. So this was a guide co-developed with the All-Can International community in a participatory process in which Greece was also involved. And we hope that this could be an actionable resource at the international level and also, of course, in Greece. So indeed, how do we go from metrics to implementations? So we do know that health systems face enormous challenges to provide efficient care for patients with cancer. In the previous study, All-Can International has identified a set of 8 metrics with potential to be implemented in daily practice in cancer care. And you can see these efficiency metrics, these cancer efficiency metrics on the left-hand side of the slides. These metrics are related to 3 main themes, which are timeliness of care, coordination of care, and patient-centeredness. However, the identification of metrics alone, it's not, of course, the unique criteria and the unique resource we have to ensure that they are implemented in practice. So we do need to prioritize implementation efforts. And this is why the All-Can International, with this broader international community, decide to develop together with the University of Amsterdam, this guide to empower stakeholders, this guide that really intends to empower stakeholders who wish to implement efficiency metrics in their health systems. What will you find in this guide, which was launched last September and which is also online available for free for all stakeholders who would like to use it? So we have 3 main aims in this guide. First, to provide guidance and recommendations for implementation, following these 3 themes that I just presented to you. Also, this guide intends to be a nonlinear tool, which means that it has different entry points. It has hyperlinks throughout the document. It has different case studies, so users don't really need to start from the end, from the start until the end. They can use the document in a nonlinear way. And thirdly, it intends to serve as a living tool. Indeed, feedback is welcome, and it is indeed the aim to foster a shared learning community. So these are the 3 aims of this action guide. What are the intended users? It is this broad network of stakeholders across the cancer care ecosystem. So it is about policymakers, managers, health technology assessment organizations. It's, of course, about people, patients, and their communities. It's all stakeholders involved in cancer care can use this guide and these recommendations. And how? In the guide, you will find these 3 entry points, which are the why, the what, and the how. You can start with each of these entry points with no predetermined order, and I will explain what they entail to you. You will also find these specific resources as part of the implementation toolkit. You will find the section Explore Further with further documentation to enrich and support your efforts. You will find the section of Identifying Barriers and Facilitators, Key Steps for Implementation, Illustrative Examples, and some practical tips for implementation. Let's start with the why entry point. The why entry point will focus on why to prioritize efficiency as a key goal in cancer care. And you can see here that All-Can defines efficiency as care that delivers the best possible health outcomes using the resources available with a focus on what really matters to patients and to society. And of course, you will see in the guide the conceptualization of efficiency as a cross-cutting dimension of health system performance, as we know. And it is, of course, important at the 3 decision-making levels of healthcare systems, from the micro to from the micro to the macro level. In the what entry point, you will find these metrics grouped according to these 3 themes: timeliness of care, coordination of care, and patient-centeredness. And you will find the health system components which are more related to each of these themes. Finally, in the how section, you will find a roadmap for implementation. You will find a step-by-step guide to really empower every stakeholder wishing to use this guide. What are the 5 steps in this section? First, setting a clear and very important, a shared goal among all stakeholders involved in your specific ecosystem, be it national, regional, or even at organizational level. The second step described in the guide is assessing your health system's preparedness. In this section, we'll find a checklist by each one of these teams to allow you to ensure that your health system is prepared, and it will also guide you to prioritize your efforts according to the level of preparedness in your specific health system. The third step is about identifying key contextual factors. So here we are talking about barriers and enablers. And these barriers and enablers were indeed identified based on the 21 interviews, including with Greece, with representatives from Greece, with George here in the panel. So we identified together with interviewing 21 representatives from 21 countries what were the main barriers and enablers from their perspectives to implement these metrics in their specific systems. You will find this, of course, more detailed in the guide, but as you can see here in an overview, you see that cluster 1, timeliness of care, and the second one, coordination of care, you see that regulatory influences seem to have a very important role in the implementation, which is about regulation. In the timeliness of care, it's about regulation, namely the national strategic control plans that was actually just mentioned by the previous speaker, and also it's about the regulation of standardized care pathways, which were found to be very helpful in improving timeliness of care. Secondly, in the coordination of care, you will see that most stakeholders referred that regulation of cancer nurse specialists and regulation of patient navigators were really key also to ensure the implementation of these metrics and to improve coordination of care. What about patient-centeredness? It is interesting to notice here that in this third cluster, the picture is somewhat different. And you can see here that political influences, mainly political will, also regulation, but the community influences, which is really the advocacy efforts, are really key, according to this data, to improve patient-centeredness of health systems. So you will find the detailed barriers and enablers in this section of the guide. So after defining the goal, assessing preparedness, identifying these contextual factors in your system, the fourth step is involving key stakeholders. So deciding who do you need to have at the table to move forward with your implementation efforts. And the fifth step is applying key recommendations. So you will find key recommendations for implementation, which are provided in the guide at 3 levels: at the national or regional level, at the organizational level, and at the community level, patients, families, and the community. I will now show you just a selection of these recommendations as they are presented in the guide per each of these 3 themes: timeliness, coordination of care, and patient-centeredness. So first, regarding timeliness of care, what can be done at the national or regional level? And we have just mentioned that the development, but not only the development and implementation, but also the timely update of national strategic cancer plans. And the second relevant point that we have identified, the regulation of standardized cancer care pathways that really ensure the adequate and timely referral of patients, seems to be a very relevant enabler to ensure timeliness of care. What can organizations do? Prioritize strengthening coordination and communication between professionals, between organizations. This seems to be also key to improve timeliness of care. And at the community level, communities and patient advocates could really advocate for enhancing the health data ecosystem, which is indeed key to monitor this timeliness of care. And of course, advocate for improving the timeliness of care delivery. So these are some of the recommendations you will find in the guide regarding to the first cluster, timeliness of care, metrics related to timeliness of care. What about the second theme, coordination of care? At the national level, it seems to be very relevant to establish regulations in the legal framework for oncology nurse navigators and also cancer care navigators, the patient navigators who really support the patients to navigate through the system. At the organizational level, you could facilitate the training of these professionals, the oncology nurse specialists, and also the care navigators. And at the community level, you can, of course, advocate for the recognition of the relevance of these professionals, as well as advocating for the health workforce safety culture, which is so important and key in this field. What about the last cluster, patient-centeredness? You will see that at national or regional level, you could consider the adaptation of existing standardized instruments to collect patient-reported experience measures and patient-reported outcome measures. You could also consider initiating and monitoring pilot projects, smaller projects, where you start implementing the standardized and systematic collection of PREMs and PROMs, and then you could scale these projects up afterwards. At the organizational level, you could develop initiatives to promote patient empowerment. And at the community level, you could advocate for increasing the political will and funding allocated to increasing patient-centeredness, which we found as really relevant enablers in this cluster of metrics related to patient-centeredness. I'd like, before concluding, to show you that in the guide, we'll also find some illustrative examples for inspirations across the world regarding the implementation of these metrics. You will find the example from Canada implementing patient navigators, from Argentina, also patient-centeredness and patient surveys in Switzerland, and also some experiences from the UK. And I'd like to conclude that we do intend that this guide is a practical and an actionable resource for for every stakeholder to use and to be more empowered to implement these efficiency metrics in their systems. So I'll be happy to receive any questions, or otherwise I wish you a very productive discussion. Thank you very much.
Dear Sofia, thank you very much for your excellent presentation. Professor Kyriopoulos, do you want to make some comments or questions?
Just one question. So, thank you very much, Sofia. I think both your presentation and Thomas's presentation was very informative in order to set the scene for the metrics and all the kind of evidence we need in order to assess cancer care. So they serve as a framework, if you like, of cancer care performance. I think, in my view at least, they were quite complementary in the sense that the one feeds some information, some input, and this one is more like patient-centric, so they're very nicely tied to each other. And I also think that it nicely ties with the OECD cancer profiles as well. So I think the three of them, they serve as like a comprehensive picture of what's going on cancer in Greece and elsewhere. So my question has to do basically with the next steps. So this is a framework, and I was wondering if you are thinking of feeding the framework with further data, with country-specific data, with Greek-specific or other country-specific indicators. So what kind of data are you thinking of collecting? And if you have any thoughts on this.
Okay, thank you for the question. So what I can tell at this moment, so our team really developed the guide, and then Allcan International will move all the other actions to really implement the guide. But what I can tell you, and I think it's really relevant in this area, is that efforts are being made to pilot this guide, which means that some countries will be selected. Between 3 to 5 countries will be selected to try to use the guide and then feed this guide with some more data. So this piloting will be done, and we hope that the piloting improves the guide and really helps then other countries to use it. So I know those are the plans for the future.
Mm-hmm. So the plan is that in the future there will be country-specific reports for each country.
Exactly, country-specific piloting process. So this guide will be used at the country level, and then to see how it can be improved, what data can be fed into the guide. So all this improvement process will be conducted at the country level in selected countries.
Mm-hmm. Great. I don't know if you have any questions, because I know that you're quite interested in this kind of work. assessing cancer care performance?
Thank you very much, Sofia, and of course, big thanks to Thomas as well for working around this. I think, as Elias noted, those are important elements in order to set up a policy towards, let's say, commonly agreed goal. I do find a specific interest on how you deal with the consistency towards reforms, because one of the biggest problems is, let's say, ownership of reforms and who actually does them. And there is, in many cases, a very low motive that's even fueled as even lesser motive by the political cycle. So there is no commitment. And I do believe that this instrument, alongside other instruments, Ilias mentioned the country cancer profiles as well. We're both involved in the country cancer profiles for Greece and Cyprus that are forthcoming in the 2025 version. I do think it's important to settle this, and I would like to ask you, as well as the table, what would be the mechanism in securing, let's say, not just political will, because this is something that's easily said, but actual ownership of the reforms, from the big ones to the tiny ones that need to take place in order to reach to an established goal.
Yeah, I think that's a very, very good and very important question. I mean, according to the data we collected and while we were developing the guide, I think that engaging every stakeholder that you find important from the start is really key. Because, of course, if you involve 2 or 3 stakeholders, 2 or 3 organizations, and you try to implement something, there is no ownership, of course, because people feel that they are involved at a later stage. So, of course, here we have this involving stakeholders as a 4th step, but we also have as a first one setting a clear and a shared goal among all the stakeholders that you can identify from the start. And that we find this was really the key step that you need to do it from the start. Then, of course, a political will, you are really dependent on some political factors that sometimes, of course, it's not in our power to change, but you have all the other organizations, the regulatory bodies, the scientific organizations, all these bodies don't change with political cycles, of course. So at least from our experience with speaking with all these stakeholders, setting this goal where you involve every stakeholder from the start at the national level or the level where you are working on is really key to ensure this ownership as far as you can. And of course then involving some of them later on if needed, but from the start is really key. Because of course then the political commitment, you can do whatever the best you can, but it's not dependent on all these bodies, of course. I hope this helps. This is what from all these interviews and the data we collected, this is really what we believe is important.
Yeah, I think that's really smart, because there is both a degree of ownership when all of them start together, but there's also, I think, a sort of a peer pressure put upon others. So yeah, I think that it could work. Yeah, thank you.